Welcome to Mindful Medicine, a podcast series of the World Stroke Academy, where we tackle the mental health challenges faced by healthcare professionals and also promote well being within our community. I am your host, Laura Chechi Galanos.
And I am Ana Cláudia. Thanks for joining us today.
So, today's episode is all about nutrition and how what we eat can directly impact our energy, our focus, as well as our resilience in the demanding world of healthcare.
And we are thrilled to be joined by Michelle Ruthenstein, a registered dietitian and preventive cardiology nutritionist who specializes in nutrition for heart and brain health. With years of experience helping busy professionals optimize their well being through science based nutrition, Michelle brings a wealth of practical insights that we can all benefit from, especially those working on the front lines of care.
Wonderful. So let's dive in. Welcome, Michelle, and thank you for being with us today.
Thank you for having me. I'm excited to be here.
Great. So perhaps the first question for our audience to get to know you is for you to tell us a little bit about yourself and what actually led you to focus on nutrition and mental health.
So I'm a registered dietitian, nutritionist, and I specialize in heart disease prevention and management through science-based nutrition. I was actually in my pre-medicine sciences in NYU, and I had to decide whether I was going to do my dietetic residency or apply to become a physician. And I decided to go more onto the registered dietitian residency, given that there is a lack of the prevention arm, right? So, medicine is so important and it's such an important aspect of our health. But when we pair in nutrition, we're able to A, make the medicine work better, but B, also improve quality of life and improve mental health, heart health, brain health, and just feeling better as well. So I took my background in the sciences and merged it within nutrition to really focus on that preventive arm, both in primary and secondary prevention, and understanding how our body works together and it's all interconnected in order to truly optimize heart health. And, during my residency, I realized that whether I was in the kidney clinic, the ICU, the step down unit, the weight loss clinics, the liver clinics, everyone was having cardiovascular complications. And I really honed into the cardiovascular well-being because of the prevalence globally of heart disease and stroke, and the fact that it can be preventable if we take early action, but also if we just take action in terms of our changing our lifestyle and our nutrition. And so I worked alongside many renowned cardiologists and neurologists and really took in that nutrition arm within the medical space to have more of a well-connected care team to really help individuals maximize their quality of life and also to improve their outcomes.
That's impressive, Michelle, and also a meaningful journey that you already built. And we were wondering here through your journey, how does what we eat influence our brain function, and also mental well-being? Could you explain a little bit about this link between nutrition, also neuroinflammation that we have a lot of works published on, and also the impact on our mental health?
Yeah, it's really important. A lot of times when we're being the caretaker, when we're the person trying to help other people, the person the helper is usually on the back burner. They're not looking at their nutrition. They're not looking at their lifestyle because they're so busy doing all these other things. But if we don't take care of you, you can't take care of all the other people. So very often people are in a rush in the morning. They're working long hours and they may not take the time to prioritize eating, prioritize movement, prioritize nourishing their body. Our bodies need a lot of different micronutrients in order for our brain to function well, in order to reduce inflammation. It needs to be focused on what we're actually eating and the timing of our meals. Because if you kind of of are just rushing through the day. You grab a protein bar here, you grab this there, but you're not actually nourishing your body. Your blood sugar levels are not stabilized, which can affect your mood and can affect your energy levels. You can have these blood sugar spikes and crashes, which don't allow you to perform and have the energy. So then after a long day, you come home and you're exhausted and you're tired and you're not giving what your body needs to be more productive at work, have more energy, have the energy to then exercise and do all the other lifestyle components. So it's really important that we take a second back and say, okay, are we nourishing our bodies? Because when we look at the dietary inflammatory index, in order to reduce inflammation, there's actually a lot of foods we need to add to the diet versus take away. And if we really focus on eating more well-balanced meals that give our body the anti-inflammatory nutrients, our brains function better, our bodies function better, we have more energy and stable blood sugars to really improve health. And I think there's this thought that, well, if I'm a healthcare professional, I'm almost like I'm not going to get sick because I'm in the healthcare field. I see a lot of cardiologists who are my clients. I see a lot of physicians and nurses who are my clients. And they go to me, Michelle, I know I should be eating healthy, but I don't know why it's not happening. And it's because they have stress. They have all these other outsider issues, and they really need to be looking at what they can improve and how they need to also take care of their health to really maximize their productivity, reduce burnout, get energy, and reduce their risk of cardiometabolic disease. Nobody is free of that unless they do the work. And that takes a little bit of preparation and prioritization that we really need to acknowledge in order to optimize everyone's health. We want you to, it's amazing how healthcare professionals can help so many people, but without them focusing on themselves too, they're not able to be more productive and give all of their needs to their clients.
Absolutely. And we mentioned it earlier, healthcare professionals usually work long shifts. They're under high stress. So maybe something that our audience might be waiting for are some practical tips that can help them maintain energy and focus throughout the day. And also maybe any specific foods that can help them combat fatigue and burnout, which is also something that we discussed in our first episode, burnout in healthcare professionals, so something unfortunately very common.
I would go really into the form of meal timing. I can't tell you how many professionals skip lunch, right? And so they have this dip in their day at 2-3 o'clock. They need another cup of coffee, and they're almost running on caffeine the entire day, thinking that, oh, I'm just tired. My brain's working. I'm doing all this. I'll just mask it with coffee. And a lot of it is your body's asking for energy. Your body's asking for a nourishing meal. So I really want to focus in on your timing of meals. If you have balanced meals that include complex carbohydrates, fiber-rich vegetables, having in a lot of lean protein and heart-healthy fats, that should take you 3 to 4 hours where your body has digested that and it's hungry again. And when you ignore hunger, you're essentially making your body overwork to maintain glucose in your bloodstream for your brain to operate. So at that 3 to 4 hour mark, when your body's saying, hey, I'm hungry, you should have something available to help you eat something. Maybe you also can take a 10-minute break for lunch, or schedule something where you do have an ability to eat in the middle of the day so it doesn't backfire at night. So a big part is being prepared, right? So if you're hungry every 3 to 4 hours and the only option is a vending machine for a snack, you're kind of also causing crashes in your blood sugar. Can you bring an apple? Can you bring a healthy, well-balanced bar with you that you have in your pocket or in your desk or somewhere available to you to help with that hunger calling, so that you can nourish your body in those moments to help you get from point A to point B? Because when we don't nourish our body and then we're crashing, it's really hard to catch up. So you go home for dinner after a long day, you start eating, you're starving, your body is not going to be satiated. So you eat your big dinner, you're like, I ate a dinner, why am I still hungry? You want to keep eating and eating. That's actually a mechanism of your body saying, you didn't fuel me earlier. So I am in a famine state before. I don't know if you're going to do that to me again. I am not telling you when I'm full. And that can actually put stress on your metabolic system, leading to increases in blood sugar and triglycerides and blood pressure too. So it's important. And you're also insulin resistant at night. So it's really not a good habit formation. We really want to shift the intake earlier to really assess, okay, starting your day off with a really good balanced breakfast, making sure you have something in the event that you can't take a lunch at a proper time, or if you aren't going to get home and dinner at a normal time, what can we do to help you get in that nutrition timely to give you sustained energy? If we're just relying on caffeine to do that, we're just spiking up cortisol levels. We're just masking the issue of optimal nutrition. And we need to be focusing more on actually eating to obtain these nutrients through our whole foods. And so that's why it's important that meal timing is something we assess for, because oftentimes when you're very busy, it's the last thing you think about.
Yeah, I was thinking here, Michelle, people they are just struggling for time and mainly the healthcare professionals. And do you have some basic tips, for them with meal planning due to these time constraints? What do you suggest, a small step each day?
Yeah, great question. So I think a lot of people get intimidated by the word meal prep. They envision like these boxes with like writing Monday, Tuesday, Wednesday, here's a snack from like it does not have to be that complicated. I am a busy healthcare professional with 4 children, and I do not have the time to be cooking laborious meals, but I do like my food to taste good. So I like to use easy hacks. So for me, that may include using already prepared, like cut up vegetables or frozen vegetables to help. It may include just creating a sheet pan of vegetables to help with my week. It also will sometimes include using what I have as a helpful system. Many of my clients will use some meals that are already prepared, or they have a cafeteria where they're working, and it's about, okay, how do we choose the appropriate options within those times? It's also about knowing that it may not be realistic to cook every single one of your meals, but how do we balance it and make it an effort to work within your lifestyle so that we're still giving yourself nourishing meals? So one, definitely small steps. This is about a long-term change. It's about taking action one thing at a time to make it a consistent long-term habit. What you do in a month is not going to be necessarily optimal for your long-term heart health and brain health. It's what you do consistently for the rest of your life. So habit formation is essential, nothing extreme. It's about personalizing the science to fit into your culture and your lifestyle and your food preparation. I used to work in Manhattan before COVID, and nobody cooked. You would put your shoes in the oven. So every single meal would eat out, and they still met their target lab parameters. They still met their weight goals. They still saw reductions in blood pressure, even though they couldn't control the sodium in their meals. We have to meet people where they are, or else people put up their hands and go, I'm not doing this. So anything extreme is not going to work long term. And some people who are like, okay, I really need to lose weight, they go on these diet fads that don't help. They actually could potentially slow down your metabolism long term. So we go step by step. In my one-on-one practice, I even go as far as saying, let's just focus on breakfast. There's so many meals and it gets overwhelming to change everything. What if we just focus on breakfast and you are mindful about, okay, I had this nourishing meal. It gave me a lot more energy. I was hungry 3 to 4 hours like I'm supposed to be. And it actually influenced my other food choices because it was so nourishing. When you make those associations, you're more likely to go forward. It's like how I say, check your blood pressure, but let's monitor what you're eating too. And when people say, wow, my blood pressure came down 20 points, how could that be? I've been on all these medications and it didn't budge. And I'm like, they're like, wow, nutrition works. When you put those two, the metrics and how you feel and your nutrition, and you pair them together and they all are in the right direction, that's how long-term diet planning works, because you're like, this is what my body needs. I want to feel good. I want to have the energy. People say I even sleep better with proper nutrition, and it's true. And so all of these things interplay with each other. But again, I know you had a whole episode on mindfulness. It's about making those connections of my effort is yielding this, and it was just a small change. So definitely small changes, making sure you're doing things that are easy to do, right? If you have to cook all Sunday on your day off, it's not sustainable. No one wants to do that on a Sunday, to be cooking all day. We have to make it realistic so that it's something that will stick and that it will be consistent for the long haul.
Absolutely. And I think the new motto, the new slogan of the podcast episode is that if a mom of 4 kids can do it, then so can you. So thank you for sharing that as well. I guess our next and last question is, and I'm sorry if you get this a lot, but if you had to create a perfect plate, you know how we talk about the perfect ratio balanced plate for both cognitive and physical well-being, what would you personally include in that plate?
Yeah. So a lot of non-starchy, fiber-rich vegetables. So maybe for me, that would be kale and carrots and Brussels sprouts and bell peppers. That's my biggest portion of my plate. Then I have my lean protein, and that for me would either be, omega-3 rich fish, or it would be some beans or some tofu, some plant-based protein, or a combination of such. Some whole grains. So half a cup of, I love barley. So I love a mushroom risotto barley that I make at home. So that would be there. And then I would probably put a little bit of avocado on top and make that into my plate, which would satisfy me for 3 to 4 hours, give me a lot of anti-inflammatory rich foods that will support my heart health, my brain health, my gut health, and keep me nourished for the amount of time that it's supposed to.
And any comments on people that have a sweet tooth? Because we know that a lot of people rely on sugar for their energy level, so they think that a chocolate bar will help them go through the day. Any comment around that?
I challenge you to pay attention to your meal timing. Oftentimes, when your blood sugar level dips, that's when you crave a chocolate bar, because biologically your body's saying, hey, I'm not having enough glucose for my brain to function. So you didn't fuel your body. So it craves it because you didn't nourish your body with actual food to help curtail it. If you had a balanced meal and you ate to your hunger scale, you would not crave that chocolate bar because your blood sugar levels would stabilize. So typically, if someone craves sugar, it's because they didn't adequately nourish their body earlier. They may be deficient in magnesium or other nutrients as well. There's a reason. A lot of times people say, oh, I have a sweet tooth, I want something sweet. But it's not because they have a sweet tooth. It's because their body is asking for something and we're not fulfilling it through nutrition. And so there's a lot more to that. I have so many people who start off with, oh, I love sweets, I always have to have sweets. And then when I actually dig deep in, their lunch wasn't satisfying. Maybe they skipped their lunch. There's a reason their blood sugar dipped. And so they're asking for sugar in the middle of the day because their body's saying, give me glucose. Is your body going to say, give me a vegetable, even though it's a carb when blood sugar dips? No, it's not a fast acting sugar. Refined sugar is fast acting. Your body wants to bring back that blood sugar into homeostasis. And so that's when we usually want something sweet. It's because the balance of our meals are completely off.
Got it. Thank you very much for that answer. Any last comments, thoughts that you want to share with our audience listening to us today? Any tips, last minute tips that you have for our healthcare professionals?
Yeah, I mean, my platform on social media and really just awareness in general is that we need to take early action, and all healthcare professionals are understanding that. A lot of cardiometabolic disease, it can happen, but it happens pretty early. And if we can catch it early, then and take proactive action, we can prevent it. So just because you're a healthcare professional, don't think that you're immune to cardiometabolic disease. It's the foundation of so many increases for heart disease, cancers, brain cognitive function. So please take care of yourself. Get your blood work done, know your numbers, make sure that you are really taking ownership of your health so you can continue giving back and doing the amazing things that you do, but it has to start from you. So make sure that you're going to the physical. You don't know, you can't feel high cholesterol. You can't feel high blood pressure. You can't feel insulin resistance. Don't ignore these signs. Get tested, optimize them, prioritize your health, because you'll be able to give back to your clients and patients a lot more effectively too.
Hmm. Michelle, thank you so much for that. Your insights into how nutrition supports both our mental and physical resilience have really been incredibly valuable. We want to thank you also for whatever kind of resource you will be sharing with us that we can include in the notes of this podcast so that our audience can access it.
Yeah,
Thank you so much
so
for having me.
yeah, Michelle, this was amazing because I think that also Laura and I, we learned a lot from you. So thank you. It highlighted how small and intentional choices in what we eat can make a big difference. So thank you. Thank you for your time and for being with us.
Thank you. I appreciate it.
And to our listeners, thank you for being with us on Mindful Medicine today. If you enjoyed today's episode, make sure to check episode 1, where we talked about burnout in healthcare, and episode 2, where we tackle the topic of mindfulness. You'll find all episodes and the resources in the show notes. Thank you very much, Michelle, once again.
Thank you.